Welcome to our documentary on reproductive health. Today we uncover 7 truths that highlight why reproductive health is not a taboo, but a source of power. Across the vast tapestry of human existence, few subjects are as fundamental, as intimately tied to our well-being and the continuation of our species as reproductive health. Yet it is a realm often shrouded in silence, in misunderstanding, or in cultural complexities that can obscure its profound importance. We embark now on a journey to illuminate this vital aspect of our lives, to explore its many facets with clarity and compassion. Here, in the myriad ecosystems of human society, the processes of reproduction and the health that underpins them are as intricate and essential as any natural cycle observed in the wild. From the first stirrings of awareness in youth to the choices that shape families and futures, reproductive health touches every individual. It is a cornerstone of personal dignity, a determinant of societal progress, and a reflection of our collective commitment to ensuring that every life can flourish. Understanding its truths is not merely an academic exercise, it is a pathway to empowerment for all. Our exploration will take us through 7 distinct yet interwoven dimensions of this critical subject. We shall examine the foundations laid by education, the autonomy granted by access to care, the miracle of new life, the rhythms of our bodies, the delicate balance of mind and health, the shared responsibilities within our communities, and the collective will required to forge a healthier future. Join us as we seek to understand, to appreciate, and ultimately to champion reproductive health as a fundamental human right and a source of immense strength. In the intricate journey of human development, knowledge, when imparted with care and accuracy, acts as a guiding light. Comprehensive sex education is precisely this illumination, an essential foundation upon which individuals can build lives of informed choice and well-being. It is far more than a simple biological overview. It is a holistic exploration of human sexuality, relationships, and health. This education, when delivered effectively, addresses not only the physical aspects of reproduction but also the emotional, social, and ethical dimensions, preparing young people for a healthy and respectful adult life. It aims to foster an environment where questions can be asked without shame and answers are provided with scientific rigor and sensitivity. The power of such education lies in its ability to transform vulnerability into strength. When young individuals understand their bodies, their rights, and the responsibilities that come with sexual health, they are better equipped to make decisions that protect themselves and others. This understanding helps to demystify processes that can otherwise seem daunting or confusing, reducing anxiety and promoting a positive self-image. It is about empowering them with the tools to navigate relationships, consent and personal boundaries, fostering respect and empathy. The echoes of this early learning resonate throughout an individual's life, influencing their choices and their interactions in profound ways. One of the most significant impacts of comprehensive sex education is its capacity to dismantle stigma. For generations, silence and misinformation have allowed harmful myths and taboos surrounding sexuality to persist, leading to fear, discrimination, and poor health outcomes. By bringing these topics into the open, into the light of reasoned discussion, education challenges these outdated notions. It normalizes conversations about sexual and reproductive health, encouraging a culture of openness and acceptance. This in turn can lead to earlier help-seeking behaviors and a greater willingness to discuss sensitive issues with trusted adults or healthcare providers, breaking cycles of ignorance. The long-term benefits for society are manifold and far-reaching. Communities where comprehensive sex education is the norm often witness lower rates of unintended pregnancies, reduced transmission of sexually transmitted infections, and a decrease in sexual violence and coercion. Educated individuals are more likely to plan their families, invest in their children's health and education, and contribute more fully to economic and social development. It is an investment not just in individual lives, but in the collective health and prosperity of future generations, creating a ripple effect that strengthens the fabric of society. However, the path to universal comprehensive sex education is not without its obstacles. Cultural sensitivities, political opposition, and a lack of trained educators can present significant challenges in many parts of our world. Overcoming these requires a concerted effort, a dialogue that bridges divides and emphasizes the shared goal of protecting young people's health and futures. It necessitates curricula that are age-appropriate, culturally relevant, and inclusive of all young people, regardless of their gender, sexual orientation, or background, ensuring no one is left navigating these crucial life stages in darkness. The role of parents, educators, and community leaders is paramount in this endeavor. A collaborative approach where schools, families, and community organizations work in concert can create a supportive ecosystem for learning. Parents, as primary educators, can be empowered with resources to discuss these topics openly at home, complementing the formal education provided in schools. Educators require ongoing training and support to deliver this sensitive subject matter effectively and confidently, creating safe spaces for learning and discussion, fostering trust and open communication. Imagine a world where every young person enters adulthood with a clear understanding of their reproductive health, equipped with knowledge and confidence. This is not a distant dream, but an attainable reality, built upon the bedrock of universal access to comprehensive sex education. It is a testament to our belief in the power of knowledge to transform lives, to nurture respect, and to build healthier, more equitable societies for all who inhabit this remarkable planet, ensuring each individual can navigate their path with dignity and informed choice. The ability to decide if, when, and how many children to have is a fundamental human right, a cornerstone of individual autonomy and well-being. Access to contraception and comprehensive family planning services is the key that unlocks this power of choice. It provides individuals and couples with the means to shape their futures, to align their reproductive lives with their personal aspirations, their health needs, and their economic circumstances. This is not merely about preventing births. It is about enabling lives to be lived with greater intention, security, and freedom, allowing for considered decisions that resonate through families and communities. The impact of this access reverberates through every facet of life. For women in particular, it can mean the difference between pursuing education or careers and facing the profound responsibilities of early or unintended parenthood. It allows them to invest more in each child, to ensure their health and development, and to participate more fully in the economic and social life of their communities. The power to plan one's family is intrinsically linked to gender equality, empowering women to take control of their bodies and their destinies, fostering a more equitable distribution of opportunities and responsibilities within society. The benefits for maternal and child health are undeniable and extensively documented. When women can space their pregnancies or limit family size according to their health and resources, the risks of maternal mortality and morbidity decrease significantly. Children born into planned families often receive better nutrition, healthcare, and education, setting them on a path to a healthier and more productive life. Family planning is therefore one of the most cost-effective health interventions, yielding substantial returns in terms of lives saved and improved quality of life for generations, a vital thread in the fabric of public health. Beyond the individual and family level, the economic advantages for communities and nations are considerable. Reduced rates of unintended pregnancies can lessen the strain on public health systems and social services. Families with fewer, healthier children are often better able to save, invest, and escape cycles of poverty. This demographic dividend, when coupled with investments in education and job creation, can fuel sustainable economic growth and development. Thus, ensuring access to family planning is not just a health imperative, but a sound economic strategy, fostering resilience and prosperity across entire populations. Despite these clear benefits, significant barriers to accessing contraception and family planning services persist in many parts of the world. These obstacles can be cultural, rooted in traditional beliefs or gender inequalities. They can be financial, placing services and methods beyond the reach of the poorest, or they can be logistical, with clinics too distant or supplies too scarce. Misinformation and lack of awareness also play a critical role, preventing individuals from seeking or using services even when available. Addressing these multifaceted barriers requires tailored, community-sensitive approaches and sustained commitment from all stakeholders. The spectrum of modern contraceptive methods available today is broad, offering a range of options to suit different individual needs, health conditions, and life stages. From short-acting methods like condoms and pills to long-acting reversible contraceptives and permanent methods, innovation continues to expand choices and improve efficacy and acceptability. Ensuring that individuals have access to a full range of these methods, along with accurate information and quality counseling to make an informed choice, is crucial for effective family planning programs. This requires robust supply chains and well-trained healthcare providers. Globally, there is a concerted effort, a quiet yet persistent movement to expand access to these vital services. International organizations, national governments, civil society groups, and healthcare providers are working tirelessly to overcome barriers, strengthen health systems, and empower individuals with the knowledge and means to make informed reproductive choices. This global partnership recognizes that the power of choice enabled by contraception and family planning is essential for achieving broader development goals, from poverty reduction to environmental sustainability, ensuring a healthier future for both humanity and the planet we share. The journey of pregnancy and childbirth is one of nature's most profound miracles, a testament to the resilience and continuity of life itself. Yet for too many women around our world, this transformative experience is fraught with peril, a path shadowed by the risk of illness, injury, or even death. Ensuring maternal health and safe childbirth practices is not merely a medical concern, it is a moral imperative, a reflection of a society's value for its mothers and its future generations. Every woman deserves the right to navigate this journey with dignity, respect, and the highest attainable standard of care. The foundation of safe motherhood begins long before the moment of birth, with comprehensive prenatal care. Regular checkups with skilled healthcare providers allow for the monitoring of both maternal and fetal well-being, the early detection and management of potential complications, and the provision of vital health education. This includes guidance on nutrition, supplementation with essential micronutrients, and preparation for childbirth and newborn care. Such proactive care significantly reduces the risks associated with pregnancy, transforming what could be a hazardous period into one of watchful anticipation and support. The presence of skilled birth attendants, doctors, midwives, or nurses trained in managing normal deliveries and recognizing complications is critical at the time of birth. These dedicated professionals can make life-saving decisions, provide emergency obstetric care when needed, and ensure a clean and safe environment for delivery. Access to facilities equipped to handle obstetric emergencies, including cesarean sections and blood transfusions, forms an essential safety net, ensuring that complications do not escalate into tragedies. The simple yet profound expertise of a trained hand can be the difference between life and death. The period immediately following childbirth, the postnatal phase, is equally crucial for the health of both mother and newborn. Postnatal care involves monitoring for complications such as infection or hemorrhage in the mother, as well as ensuring the baby is thriving, initiating breastfeeding, and receiving necessary immunizations. It is also a time to provide support for maternal mental health, recognizing the significant adjustments and potential challenges of new motherhood. Comprehensive postnatal care completes the continuum, ensuring a healthy start for the new family unit, a gentle transition into a new chapter of life. Despite significant progress in recent decades, stark disparities in maternal mortality persist across our globe, a poignant reminder of the inequities that still divide our world. Women in low-income countries, in remote rural areas, or from marginalized communities often face the greatest risks, lacking access to the basic services that women in wealthier settings take for granted. Addressing these disparities requires a multi-pronged approach. Strengthening health systems, training and deploying more healthcare workers, improving infrastructure and tackling the social determinants of health that put these women at a disadvantage. The emotional and societal impact of safe motherhood extends far beyond the individual family. When mothers are healthy, their children are more likely to survive and thrive, their families are more stable, and their communities are stronger. The loss of a mother has devastating consequences, creating ripples of hardship that can affect generations. Investing in maternal health is therefore an investment in the very fabric of society, nurturing the bonds that hold communities together and fostering an environment where families can flourish, contributing to a cycle of well-being. Innovations and dedicated efforts continue to drive progress in maternal health care worldwide. From community-based interventions that bring care closer to women's homes to new technologies that improve diagnostics and treatment, the commitment to making childbirth safer for every woman is unwavering. This includes empowering women themselves with knowledge about their rights and the importance of seeking care. It is a collective endeavor, a testament to our shared humanity, striving to ensure that the miracle of bringing new life into the world is a joyous and safe experience for all. Menstruation, a natural and cyclical biological process, is an integral part of life for billions of individuals across our planet. It is a sign of health, a marker of the reproductive years, a fundamental rhythm that has accompanied humanity throughout its existence. Yet, despite its universality, menstruation is often surrounded by a veil of silence, misinformation, and deeply ingrained cultural taboos. Understanding and addressing menstrual health and hygiene is not just a matter of comfort. It is a critical component of health, dignity, and gender equality, essential for enabling individuals to participate fully in life. Breaking the silence and dismantling the stigma associated with menstruation is the first crucial step. For too long, cultural myths and societal discomfort have led to shame and secrecy, preventing open discussion and hindering access to essential information and resources. Education plays a pivotal role here, not only for those who menstruate, but for entire communities. Normalizing conversations about menstruation helps to create an environment where it is viewed as a natural bodily function, rather than something to be hidden or embarrassed about, fostering a more supportive and understanding society. Access to appropriate menstrual hygiene materials, such as sanitary pads, tampons, menstrual cups, or clean, reusable cloths, and safe private facilities for managing menstruation are fundamental needs. In many parts of the world, particularly in low-income settings, these basic necessities are luxuries. Lack of access can force girls and women to use unhygienic materials, increasing the risk of reproductive and urinary tract infections. It can also lead to missed school days or work days, creating significant personal and economic disadvantages, a silent barrier to progress. The impact of poor menstrual health and hygiene management on education and economic participation, particularly for girls and women, is profound. When girls lack access to sanitary products or adequate sanitation facilities at school, they may stay home during their periods, leading to significant absenteeism and eventually a higher likelihood of dropping out of school altogether. This curtails their educational attainment and future opportunities. Similarly, women in the workforce may face challenges if their workplaces do not provide adequate facilities, impacting their productivity and career progression. The health implications of neglecting menstrual hygiene extend beyond infections. Conditions such as endometriosis or polycystic ovary syndrome, which can affect menstrual cycles and cause significant pain or discomfort, often go undiagnosed or mismanaged due to a lack of awareness and the normalization of menstrual pain. Promoting menstrual health involves not only hygiene, but also encouraging individuals to seek medical advice for irregularities or severe symptoms, ensuring that underlying health issues are addressed promptly and effectively, safeguarding long-term well-being. Education about menstruation should be inclusive, reaching boys and men as well as girls and women. When boys and men understand menstruation as a natural process, they are more likely to be supportive partners, family members, and community members. This understanding can help to challenge discriminatory practices and attitudes, fostering empathy and respect. It contributes to creating environments in schools, homes, and workplaces where menstruating individuals feel comfortable and supported, rather than stigmatized or marginalized for a simple biological reality. Across the globe, community-led initiatives and innovative solutions are emerging to address the challenges of menstrual health and hygiene. From local production of affordable sanitary products to the construction of girl-friendly latrines in schools, these efforts demonstrate a growing recognition of the importance of this issue. Advocacy for policies that ensure access to menstrual products and promote menstrual health education is gaining momentum, driven by the understanding that this is not a niche concern, but a fundamental aspect of public health and human rights, vital for the flourishing of all. The human experience is a delicate interplay of body and mind, an intricate dance where physical health and mental well-being are profoundly interconnected. Nowhere is this connection more apparent, yet often less acknowledged, than in the realm of reproductive health. The physiological changes, societal pressures, and personal experiences associated with our reproductive lives can exert a powerful influence on our emotional state, our resilience, and our overall mental equilibrium. Understanding this unseen connection is vital for a truly holistic approach to health and care. Hormonal fluctuations, the very essence of the reproductive cycle, can significantly impact mood and mental well-being. From the onset of puberty through the monthly cycles of menstruation, during pregnancy and the postpartum period, and into menopause, these natural shifts can sometimes trigger or exacerbate conditions such as anxiety, depression, or premenstrual dysphoric disorder, PMDD. Recognizing these biological underpinnings is crucial, not to dismiss experiences as just hormones, but to validate them and seek appropriate support and management strategies when they become overwhelming. Beyond the direct physiological impacts, many experiences related to reproductive health can carry a heavy emotional burden. The journey of infertility, for instance, can be a deeply distressing and isolating experience for individuals and couples, often accompanied by grief, frustration, and a sense of failure. Similarly, pregnancy loss, whether through miscarriage or stillbirth, can lead to profound sadness and trauma. The diagnosis of a sexually transmitted infection or conditions like endometriosis or PCOS can also bring with them significant emotional distress, anxiety about the future, and concerns about relationships and fertility. Societal pressures and stigma surrounding reproductive health issues further compound the mental health challenges. The expectation to conceive, the shame associated with STIs, the silence around menstrual disorders, or the lack of understanding for postpartum depression can create an environment where individuals feel unable to speak openly about their struggles or seek help. This isolation can deepen feelings of despair and anxiety. Conversely, positive and supportive social environments where reproductive health is discussed openly and without judgment can be incredibly protective for mental well-being. The importance of integrated care, therefore, cannot be overstated. Healthcare approaches that address both the physical and mental aspects of reproductive health are essential. This means screening for mental health concerns during routine reproductive health visits, providing access to counseling and psychological support services, and ensuring that healthcare providers are trained to recognize and respond to the emotional needs of their patients. It means treating the whole person, acknowledging that the mind and body are not separate entities but parts of a cohesive, interconnected system. Building robust support systems is key to navigating the emotional complexities of reproductive health. These can range from formal therapeutic interventions to informal support from family, friends, and peer groups. Destigmatizing mental health struggles and encouraging help-seeking behavior are critical societal shifts. When individuals feel safe and supported in sharing their experiences, the burden they carry can be lightened, and pathways to healing and resilience can open up, fostering a culture of compassion and understanding. Ultimately, good reproductive health can positively influence overall mental resilience and quality of life. Feeling in control of one's reproductive choices, experiencing healthy pregnancies, managing menstrual health effectively, and navigating reproductive transitions with support can contribute to a stronger sense of self, greater emotional stability, and enhanced well-being. By acknowledging and nurturing the profound connection between our reproductive lives and our mental state, we empower individuals to lead fuller, healthier, and more emotionally balanced lives, recognizing the delicate harmony that sustains us. For too long, the conversation around reproductive health has been predominantly and sometimes exclusively framed as a women's issue. Yet, reproduction, by its very nature, involves all genders, and the health and well-being associated with it are a shared responsibility. Men have an indispensable role to play, as partners, as fathers, as advocates, and as individuals with their own reproductive health needs. Recognizing and actively engaging men is crucial for achieving comprehensive reproductive health outcomes for everyone within our communities. Men are, quite simply, equal partners in reproduction. Their health, their choices, and their attitudes significantly impact not only their own reproductive capabilities, but also the health and well-being of their partners and children. This involvement extends beyond the act of conception. It encompasses supporting a partner's decisions about family planning, accompanying them to prenatal visits, being actively involved in childbirth and postnatal care, and sharing the responsibilities of parenting. Such engagement fosters stronger relationships and healthier families. It is also vital to acknowledge and address men's own reproductive health needs. This includes understanding male fertility, preventing and treating sexually transmitted infections, and being aware of conditions such as prostate and testicular cancer. Just as women require access to information and services tailored to their needs, so too do men. Creating male-friendly health services and promoting health-seeking behaviors among men can lead to better overall health outcomes for them and, by extension, for their families and communities, ensuring their specific concerns are not overlooked. Supporting partners' choices and health needs is a cornerstone of responsible male engagement. This means respecting a partner's autonomy in decisions about contraception, pregnancy, and childbirth. It involves active listening, open communication, and a willingness to share in the decision-making process. When men are supportive and informed, their partners are more likely to access and utilize reproductive health services, leading to improved maternal and child health outcomes. This supportive role is a powerful catalyst for positive change. Challenging harmful gender norms and stereotypes is another critical aspect of men's involvement. Traditional notions of masculinity can sometimes discourage men from expressing emotions, seeking healthcare, or participating in what might be perceived as feminine roles, such as childcare or discussions about contraception. By questioning these restrictive norms, men can help create a more equitable environment where both men and women feel empowered to make informed decisions about their reproductive lives and share responsibilities more equally. The benefits for men themselves in being actively involved in reproductive health are significant. Greater involvement in family planning and parenting can lead to deeper bonds with their partners and children, enriching their personal lives. Increased awareness of their own health can lead to earlier detection and treatment of potential issues. Furthermore, contributing to a more gender-equitable society benefits everyone, creating communities that are more just, harmonious, and prosperous for all their members. Across diverse cultures and settings, we see inspiring examples of positive male engagement. Men participating in couples counseling for family planning, fathers attending antenatal classes, male community leaders advocating for reproductive rights, and young men championing respectful relationships. These are all powerful indicators of a shifting paradigm. Encouraging and scaling up such initiatives is essential for fostering a world where reproductive health is truly understood and embraced as a shared human concern, a collective endeavor for the well-being of all. The journey towards universal reproductive health and rights is not solely a matter of individual choice or medical intervention. It is profoundly shaped by the landscape of laws, policies, and societal norms. Advocacy and policy change are the powerful levers that can transform this landscape, dismantling barriers and creating enabling environments where every individual can exercise their reproductive rights freely and safely. The collective voice, amplified through advocacy, has the power to demand and secure lasting improvements for generations to come. The need for robust laws and policies that protect and promote reproductive health cannot be overstated. These legal frameworks should guarantee access to comprehensive sexuality education, a full range of contraceptive methods, safe abortion services where legal, quality maternal health care, and prevention and treatment for sexually transmitted infections. Policies must be grounded in human rights principles, ensuring non-discrimination, equality, and the autonomy of individuals to make decisions about their own bodies and futures without coercion or fear. International agreements and national legislation play a crucial role in setting standards and creating obligations for governments. Conventions such as the Convention on the Elimination of All Forms of Discrimination Against Women, CDR, and programs of action from conferences like the International Conference on Population and Development, ICPD, provide a global consensus and a framework for action. Translating these international commitments into effective national laws and then ensuring their implementation and enforcement is a continuous process, requiring vigilance and sustained advocacy. Grassroots movements and community organizing are often the driving force behind significant policy changes. Ordinary citizens, civil society organizations, healthcare providers, and affected communities, when they unite their voices, can create powerful momentum for reform. By raising awareness, mobilizing public support, and engaging directly with policymakers, these movements can challenge restrictive laws, demand better services, and ensure that the lived realities of people are at the center of policy making. Their passion and persistence are indispensable. Holding governments and institutions accountable for their commitments to reproductive health is a vital function of advocacy. This involves monitoring the implementation of policies, tracking budget allocations, highlighting gaps in services, and demanding transparency. It means ensuring that resources are directed where they are most needed and that services are accessible, affordable, and of high quality for all, especially for marginalized and vulnerable populations who often bear the brunt of inadequate policies. This scrutiny ensures promises translate into tangible improvements. The importance of adequate funding and strategic resource allocation for reproductive health programs is paramount, and advocacy efforts must continually make the case for increased investment, demonstrating the profound health, social, and economic benefits that accrue from comprehensive reproductive health services. This includes advocating for domestic resource mobilization as well as international development assistance, ensuring that financial commitments match the scale of the need and the ambition of the goals we strive to achieve. Our vision is for a world where reproductive rights are not just enshrined in documents, but are a lived reality for every person on this planet. This requires a sustained, multi-level effort, from individual conversations that challenge stigma, to community actions that demand better services, to national and global advocacy that shapes just and equitable policies. It is through this collective will, this unwavering commitment to shaping a more just future, that we can ensure reproductive health is universally recognized and upheld as a fundamental human right, empowering all to thrive. Thank you for joining us in exploring these vital truths about reproductive health. Remember, it's not a taboo, it's power. Let's continue to embrace and advocate for reproductive health for all. We have journeyed through the critical importance of education, the freedom afforded by choice, the preciousness of maternal well-being, the natural rhythms of our bodies, the intricate link with our minds, the shared responsibility across genders, and the enduring power of our collective voice to forge change. Each truth underscores a fundamental aspect of our humanity. The path towards universal reproductive health is one of ongoing learning, compassion, and concerted action. It requires us to challenge silence, to dismantle stigma, and to build societies where every individual is equipped with the knowledge, resources, and support to make informed decisions about their own body and future. This is not merely a health issue. It is a cornerstone of human dignity, equality, and the sustainable development of our global community, a testament to our shared commitment to a brighter tomorrow. Let the understanding gained here fuel a renewed commitment in each of us. Whether it is by fostering open conversations within our families and communities, supporting organizations working on the front lines, or advocating for just policies, every action contributes to a world where reproductive health is celebrated as a source of strength and well-being. Together, let us ensure that this power is accessible to all, creating a healthier, more equitable future for every inhabitant of our remarkable world.